Right now, millions of people over 60 are waking up every single morning and doing something that is quietly destroying their joints. And the worst part? They think they are doing the right thing. They feel that pain, that stiffness, that grinding ache, and they stay in bed longer. They rest. They wait for it to pass. And every single morning they do that, they are making it worse. I want to show you something today that changed the lives of several of my patients. People who were heading straight toward joint replacement surgery, who turned it around completely with 5 minutes. Not 5 weeks, not 5 months, 5 minutes. Every morning, before their feet even touched the floor. My name is Dr. Nathan Wells. I have been practicing internal medicine for over 20 years with a focus on senior health and preventive care. And what breaks my heart, genuinely breaks my heart, is watching patients come into my clinic who have been in real pain for years, and when I ask them what they have been doing about it, they tell me they have been resting, waiting, hoping it would get better on its own. That is why I made this video. I do not want that to happen to you. Let me tell you about Harold. Harold was 72 years old, a retired postal worker who had walked mail routes for over 3 decades. The man had logged more miles on foot than most marathon runners. He came in to see me about 18 months ago with dull, aching hip pain that hit him every single morning the second he tried to get out of bed. He told me he had decided his hips were just worn out, used up. So he started sleeping in later, sitting in his recliner more, taking it easy. Because that is what common sense tells you to do when something hurts. Harold, I am telling you, Harold had the best intentions. And those intentions cost him dearly. Because here is what most people do not know about joints. They have no direct blood supply. None. Your joints cannot feed themselves. The only way your cartilage gets the nutrients it needs to stay healthy and rebuild is through movement. When you move, you pump a fluid called synovial fluid through the joint. It acts like oil in an engine, like the lubricant that keeps everything gliding smoothly. When you stop moving, that fluid pools, thickens, and settles, and the cartilage starves. Within 2 years of cutting back his activity, Harold went from mild morning stiffness to bone-on-bone friction in both hips. He is now scheduled for a double hip replacement surgery that his orthopedic surgeon told him had a very real chance of being delayed, maybe avoided entirely, if he had kept moving even moderately. I think about Harold a lot. Now here is the piece that the Centers for Disease Control confirmed in their arthritis research, and this number stopped me cold when I first read it. Physical activity can decrease arthritis pain and improve function by about 40%. 40%. That is comparable to what many patients get from pain medication. Yet 1 in 3 adults with arthritis remain completely inactive. You have a treatment sitting right inside your own body that costs you nothing, and most people are not using it because nobody told them how. So what is actually happening in your joints while you sleep? There is a clinical term for it, the gelling phenomenon, and it is exactly what it sounds like. Overnight, your synovial fluid cools down and thickens into a gel-like consistency, especially in your knees, hips, and lower back. Your tendons and the tissue around your joints tighten up from hours of stillness. Your spinal discs, which are up to 80% water, slowly compress and lose hydration as you sleep. And on top of all of that, if you went to bed even mildly dehydrated, which most seniors do, because the sensation of thirst actually diminishes with age, your body literally cannot produce enough synovial fluid to properly lubricate your joints in the morning. Think about what it is like to pour cold maple syrup straight out of the refrigerator. It barely moves. It clings to the spoon. It does not flow. Now warm that same syrup for 30 seconds and watch what happens. It runs smoothly and easily. That is your synovial fluid, cold and stiff after 8 hours of sleep. It does not circulate. It does not lubricate. It sits. And when you stand up and force your full body weight onto joints that are running dry, that is where the pain comes from. That grinding, that aching, that first step wince that so many of my patients describe. Now let me tell you about Susan. Susan was 68, a retired teacher who spent 35 years on her feet in a classroom, and she came to me with severe morning knee stiffness that she said took close to an hour to go away every single day. She figured it was the years of standing on hard classroom floors catching up with her. X-rays showed mild osteoarthritis, real but not severe, and I told her something that genuinely surprised her. I told her to stop waiting for the stiffness to pass on its own, and instead start moving before she even stood up. Here is what I want to be honest with you about, because I think you deserve to hear this. Most people think the morning stiffness is the problem. It is not. The stiffness is a signal. It is your body telling you that your joints are under-lubricated and your surrounding muscles are not doing their job as shock absorbers. The real problem, the dangerous one, is what happens when you ignore that signal day after day, year after year. So this is what Susan did. And this is what I want you to start doing tomorrow morning. Before your feet touch the floor, before you reach for your phone, before anything else, you spend 5 minutes in bed doing 4 simple movements. That is it. 5 minutes. The first thing you do is ankle pumps. You simply flex your feet up toward your shins, then point them away from you. Up and down, 10 times each foot. This sounds almost too simple to matter. But here is what it is actually doing. It is pumping blood back into the lower legs after hours of lying still. It is activating the calf muscles, and it is beginning to mobilize the fluid in your ankle joints so they are not stone cold when you stand. The Journal of Orthopaedic and Sports Physical Therapy found that dynamic movement before bearing weight significantly reduces microtrauma to the tendons in the foot and ankle. 10 pumps, 30 seconds. Start there. The second movement is seated knee extensions. Sit up on the edge of your bed, do not stand yet, and slowly straighten one leg out in front of you. Hold it for a 2 count, then lower it. 5 times on each side. What this does is pump synovial fluid directly into the knee joint without any compression or body weight on it. You are essentially priming the engine before you turn the key. The journal Osteoarthritis and Cartilage has documented that crepitus, that grinding bubble wrap sound your knees make, is a predictor of cartilage wear progression. This movement begins to address that before you take a single step. The third movement is glute bridges. Lie back down, bend your knees so your feet are flat on the mattress, and gently lift your hips off the bed 5 times. Hold each one for a breath. This is the one my patients resist the most because it feels like exercise, and they did not come here for exercise. But listen to me. The research published in Arthritis Care and Research is very clear that quadriceps and glute weakness is a primary risk factor for knee and hip osteoarthritis progression. Your muscles are supposed to act as shock absorbers. When they are weak, every pound of your body weight crashes directly into the joint cartilage. 5 glute bridges every morning begins rebuilding that protection. And the fourth thing, the one most people overlook entirely, is the spinal twist. Still lying on your back, bend your knees and let them fall gently to the left side of the bed. Hold for a breath, then bring them back up and let them fall to the right. 3 times each direction. Think of your spinal discs like a kitchen sponge that has dried out overnight. Stiff, compressed, cracked at the edges. A gentle twist is like slowly wringing that sponge and soaking it back in water. It mobilizes the fluid in your discs and releases the fascia, the connective tissue, that has essentially glued itself together during 8 hours of stillness. Now, before you go do any of this, I want to pause here for just a moment. If any of what I am describing sounds familiar to you, the morning stiffness, the first step pain, the grinding when you go up the stairs, I want you to go to the comment section right now and type the word yes. Just that. Yes. Capital letters. Because I read every comment on this channel and I want to know how many of you are dealing with this every single morning. And if this video is helping you, please hit the like button right now. It takes 1 second and it tells the platform to show this video to more people over 60 who need to hear this. Now, on top of those 4 movements, there is one more thing I want you to do. Tonight, before you go to bed, I want you to fill an 8-ounce glass of water and set it on your nightstand. And tomorrow morning, before your feet are allowed to touch the floor, you drink that entire glass. Your cartilage is up to 80% water. Overnight, your body loses roughly a pound of water just through breathing and perspiration. A study published in the Journal of Aging Research confirmed that systemic dehydration in older adults directly worsens pain perception and limits joint mobility. You are waking up dehydrated every single morning, and your joints feel it. I want to tell you what happened with Susan, because this is the part that stays with me. 3 weeks after she started this 5-minute routine, just 3 weeks, she came back to my office and told me her morning pain had dropped from what she described as a 7 out of 10 to a 2. She was back in her garden. She sent me a photograph of herself kneeling in her flower beds, which she had not been able to do in over a year. She did not need surgery. She did not need injections. She needed 5 minutes of the right movements done in the right order before she stood up. That is the difference. Not between doing a lot and doing nothing. Between doing the right thing at the right moment. Now, there are 2 specific conversations I want you to have with your doctor at your next appointment. Ask for a standing X-ray of your knees or hips, specifically a weight-bearing X-ray. The reason this matters is that X-rays taken lying down do not accurately show joint space narrowing, which is the measure of how much cartilage you have left. The standing version shows what your joints actually look like under pressure. And ask for 2 blood markers, an hsCRP and an ESR. These check for systemic inflammation and help your doctor determine whether your pain is mechanical osteoarthritis or something autoimmune like rheumatoid arthritis, because the treatment approach is very different. According to data from the National Institutes of Health, over half of all adults diagnosed with symptomatic knee osteoarthritis will eventually undergo a total knee replacement. Over half. But the CDC also tells us that the single most effective non-surgical intervention, more effective than most people realize, is targeted physical activity. Not aggressive exercise. Targeted movement, done consistently, starting the moment you wake up. You worked hard for your independence. You did not get to this stage of life to spend your mornings in pain and your days avoiding the stairs. The joint pain you feel every morning is not a sentence. It is not the inevitable cost of getting older. It is a signal your body is sending you, and now you know what to do with it. So tonight, set that glass of water on your nightstand. Tomorrow morning, do not jump out of bed. 10 ankle pumps, 5 knee extensions on each side, 5 glute bridges, 3 spinal twists each direction. Then drink your water. Then stand up. That is your morning from now on. Share this video on Facebook right now. Tag your spouse, your sibling, your best friend, anyone over 50 who starts every day with stiff, aching joints. You might be the reason they wake up tomorrow and finally do something about it. And subscribe to this channel because every week I bring you research-backed health information built specifically for people over 60. Bring someone you love along with you. Your joints have been asking for help every single morning. Now you know how to answer them. I'm Dr. Nathan Wells. Stay aware, stay proactive, and take care of yourself. I'll see you in the next one.